Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Amelia together with my colleague EDDY HERMANTO. We are from Oral and Maxillofacial Surgery Department, Faculty of Dentistry, Hang Tuah University, Surabaya. We will present about blood pressure difference before and after local anesthesia using lidocaine and adrenaline 1 and 200,000 in hypertensive patient. Our background research, first of all, as a dentist, I'm sure we always, or not always, yeah, we usually perform tooth extraction, especially for patients with hypertension, and in this case, hypertension stage 2. Most of us may be confused. We should use local anesthesia with or without adrenaline. In literature research, we found out that some literature suggests we can use adrenaline, but the others inhibit us to using adrenaline because it will increase blood pressure significantly. The problem of current research itself, and also this is our aim of research. There is no actual data about systolic blood pressure and diastolic blood pressure. And that's why we want to know more deeply about how lidocaine and adrenaline 1 and 200,000 affect systolic and diastolic blood pressure. And also in this research, we have detailed data for each patient so we can see the direct effect about lidocaine and adrenaline 1 and 200,000 concentration. Our materials and method, first of all, before we conduct the research, we should prepare the local anesthetic solution from current lidocaine and adrenaline in the market. Actually, we dilute current anesthetic local solution. We dilute it until we get 1 and 200,000 concentration of adrenaline. And after we have the local anesthetic solution, we measure first the blood pressure for patient with hypertension stage 2. And after measuring blood pressure, we conduct local anesthesia. In this method, we using mandibular block anesthesia. And after performing anesthesia, we measured the blood pressure again. And we write the data. Also, we analyze the data so we can find this result. First, systolic blood pressure before and after injecting local anesthesia, lidocaine and adrenaline 1 and 200,000 concentration was not significantly different. Also, diastolic blood pressure. And we also find that systolic and diastolic blood pressure before anesthesia injection have correlation each other. This is our statistic method. We were using paired sample test to understand or to find the difference about systolic and diastolic blood pressure in here before we injecting the local anesthesia. And here is systolic and blood pressure and diastolic blood pressure after we injecting local anesthesia. All of them, both systolic and diastolic blood pressure, do not have any significant difference. As we can see on the graph, there is slight increase systolic blood pressure, but it's not significant different. And also in diastolic blood pressure not increase at all. This is same mark in here. That's why the result using lidocaine and adrenaline 1 and 200,000 concentration will not increase systolic and diastolic blood pressure for patients with hypertensive stage 2. And also we found out the correlation systolic and diastolic blood pressure before and after local anesthesia injection. Okay, the discussion itself, in this research, we found out that the use of adrenaline at the concentration of 1 and 200,000 in local anesthesia does not significantly increase blood pressure because this dose is relatively low concentration and it is safe for patients with hypertensive stage 2. This implies that the total amount of adrenaline administration itself was small, then it can reduce the potential systemic effects. Another research found out that if we use lidocaine and adrenaline in higher concentrations, such as 1 and 100,000 concentration, it can significantly increase the systolic and diastolic blood pressure. The conclusion itself, the combination of local anesthesia with adrenaline at 1 and 200,000 concentration has been deemed safe and effective for hypertensive patients. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.